Deep dermal sutures can be used in two ways. They can be used to approximate the skin if you're going to close the skin layer over it to like a subcuticular stitch on top, or if you come superficial, you can actually close the skin with interrupted deep dermal sutures. That'd be an example would be like if you're closing a port after laparoscopy, you can put 1 or 2 deep dermal stitches in, or if you're closing skin after a melanoma excision, you could put a couple of these in. First thing you're going to want to do, grab the skin with your Adsons or power pads, go in deep in the dermis, and then you're going to want to come out pretty superficial. That's if you're actually closing the skin, so within about 1 millimeter. If you're going to run a subcuticular stitch on top, then you can come out about 1 or 2 millimeters under the surface of the skin. But for this, we want to be really close, like about 1 millimeter or less. Then to come in on the other side, you also want to make sure you know which side you want your tail to be on. So now I've got the tail close to me, so I'll come right under the skin here, and then I'll bring the needle out close to me as well. So the loop is far away, then the needle and the tail are close to me. Now, as you know, I started on the left side going deep, and then deep to superficial. Then on the right side I go superficial deep. The superficial part is going to bring the skin together, and then the starting and ending deep is going to help me to tie my knot deep so it won't bother the patient. For this you can do surgeon's knot if you want, but you don't have to. 2 throws is first knot, second, third. Usually you'd be using 3 or 4 Vicryl, and you would just do 4 knots. I just have a bunch of this nylon suture that I'm using. So for nylon, 6 knots. For 3 or 4 Vicryl, just 5 throws, which is 4 knots. Then you're going to want to pull up here, and you actually do need to cut this short, maybe about 1 millimeter or so or less, because you don't want it to rub against the patient's skin. So as you can see here, it's got a nice stitch in there, and the knot is very deep. You could actually, if it sticks up, you can actually push it down a little deeper, and that brings the skin together nicely. You would do these about every half a centimeter or centimeter along the length of the incision, but you can actually see this is a few centimeters long. It's really holding a lot of that together just from that one stitch.